Hello, everybody. We want to welcome you to the after show of Community Conversation, Hesitate or Vaccinate. We thank you for watching the Community Conversation and sticking around because we have some great guests who will be able to talk to us and give us some real-time answers to your questions. We want to introduce our panel right now. Right there, you're looking at Dr. Ricky Woods. He is the pastor of First Baptist Church West. And then we have Miss Astrid Chirinos. And if you could just say hello, Miss Astrid, so we can get your picture up there.
Yes, how are you?
There you go. There's Astrid Chirinos. She is the Executive Director for Community Engagement with the YMCA. And then we have Dr. Cheryl Walker-McGill. If you can say hello, Dr. Cheryl Walker-McGill.
Good evening.
There we go. And she is the Medical Director of the Carolina Complete Health. Thank you so much. And if they look familiar, they are, because they were part of the community conversation, and they so graciously stopped by to give us their thoughts on the community conversation that we just aired on WBTV. So we're going to start with you, Dr. Cheryl McGill. Tell us, what were your initial thoughts of the community conversation? What stood out to you?
Well, first of all, congratulations on an excellent show. I thought that it addressed, it certainly featured folks who expressed some concerns and why they had concerns. And it balanced it also with, from scientists and healthcare professionals, and just talking about some of the information that we have. And so I think it was a wonderful presentation. And so I'm really happy to be part of this discussion.
Thank you, thank you. Astrid Chirinos, tell me, what did you think of what's your initial reaction about the community conversation, hesitate or vaccinate?
Well, I'll have to echo the doctor's comments, really balanced, very informative. You really backed up your facts, your information. You gave a good range of, of views. And it wasn't in any way biased or, just focus on one area or another one. So I really learned a lot too, in terms of the makeup of the vaccine itself. That I took I took the Moderna, and other people take the Pfizer or the Johnson & Johnson, and how are they different, and why did I get tired or whatever afterwards, because I'm creating antibodies. But sometimes you don't get all that information because you're just so excited just to get the vaccine that, you kind of miss all of those things. So I think it was very well done. Congratulations.
Well, thank you. We really do appreciate that. And you learned something, so that is good. And that's what the community conversation was all about, so that we can pump people with information so they can make the right decision concerning their lives and things like that. Dr. Ricky Woods, tell me, what was your initial reaction? What did you think of the community conversation?
Well, there were two things that stood out for me. One, the intimate stories, particularly the story with Wynn Hughes and the loss of his dad. It helped to make the issues and the dangers of COVID be more than statistics to come alive. And then the second part, highlighting African-American doctors and women doctors in this month of Women's History Month. As well as Atrium Health announcing their efforts with a new medical school partnership with Wake Forest Medical School of seeking to recruit and provide scholarship dollars for minority students in the health science field. I thought this tied in perfectly.
Yeah, that's very interesting, because in talking to the relatives of the Tuskegee syphilis study, that's one thing that they said, in order to increase the trust, is that to have more doctors who look like us, more African-American doctors, because they were saying that African-American doctors can get through to their African-American patients, and there's automatic trust there. So that is good, that hopefully with that medical facility, medical school coming, that hopefully more African-American minority doctors will be in the pipeline. So if we ever have this again, God forbid, that we'll have some more doctors who look like us. So let's get to the question. We asked the social media question, and we asked, why haven't you gotten the COVID-19 vaccine, and people have responded. Stacy C, she responded and says that the reason why she hasn't gotten the COVID-19 vaccine is that it's a very high recovery rate, very little knowledge on long-term effects of the vaccine. Carmen J wrote, because you can't get an appointment. We're hearing that a lot. And then Timothy wrote, I'll just rely on my immune system. We're going to start with the doctor in the house. Tell us, what do you think about those responses, and what do we need in order to educate us? Especially, can we rely on our immune system and the long-term effects of the vaccine? Because that is a concern. How can you address that, Dr. Cheryl?
Okay, the first thing I'd like to say, and I hope this comes across okay, but it's really not about you, right? So think about it like that. It's not just about you. It's about all the people that you're around, the people that you love, the people that you care about. So certainly there are many folks, most folks who actually will get infected are not going to get very ill. And, depending on which age group and if you have any underlying conditions, et cetera, but most folks are not going to get severely ill. Most folks are not going to have to go into the hospital. But it's not just you. You're around other people. You have family members. You have loved ones. And so my feeling is that when you think about when you think about whether or not you're going to get the vaccine, and also whether or not you're at risk for getting the virus, I would challenge you to think about all those people in your life that you care about. So it's not just your immune system and whether or not you can handle it, but can they? And so what we do know is that over 550,000 Americans have succumbed to the virus. And, I have to say that in the past few weeks, I've actually known some folks personally, folks that have known friends of our family, et cetera. And so it hasn't stopped yet. So that's what I'd like to say. To the second thing, as far as access, well, by golly, let's fix that, okay? Because there's a lot of effort that's going into making sure that everyone has access to getting vaccinated. And so if you are having problems, then contact other folks, whether it's your church, the health department, keep at it, your friends. Make it a team effort in the community, because we really do need to make sure that everyone has access. There's a lot more vaccine that's available now. There's a lot of effort that's going into it. There's a lot of effort that's going into it across our state and in Mecklenburg County. So let's get everybody vaccinated.
Yeah, thank you. And talking about access, Astrid, I know we talked about that, about getting rid of some of the barriers. We were talking about taking the vaccine to the workplace, because a lot of people just can't take off 2 days to get the dose, and they may have challenges taking off that 1 day to get the 1 dose for Johnson & Johnson. So tell us, where are we with that access and removing those barriers, especially with the minority communities?
Yeah, well, we're still not there, Dedrick. Employers are still not making it easier, and especially when you're an hourly worker, employers are not going to pay you to be out of work. And 2 days or even 1 day, is critical. It could be, who knows, a car payment, your light bill, whatever. So it is important that we realize we meet people where they are. And this is what equity is about. It's not a one size fits all. And remember that a lot of our newcomers and immigrants, Spanish speakers and non-native English speakers, come from countries where they don't trust government. And certainly our last administration didn't give any kind of reason to trust them in relationship to their safety and their, being under attack so many times. So, having the vaccine being administered by government or having done it so fast and all of those different things do not build up the trust of a lot of our newcomer and immigrants. And then you make it more difficult by asking them to take time off from work. Many times you don't have Spanish speaking people that are supporting or assisting to be able to provide the to administer the vaccine. So we just need to break down those barriers and really understand that this is what it's about equity. We just have to we're in the 21st century, and this COVID has shown us that disparities are real and bigger than we were thinking. We can no longer turn our heads and say, live in a makeup world. This is a reality, and this is creating more disparities, or this is uncovering all the disparities. So I definitely will encourage our employers and our community to understand there is mistrust, distrust. A lot of people, you've showed it very well, especially our communities of colors do not have a reason to trust government. So we just need to build up that credibility and provide the access and the support to be able to sustain that trust.
Yeah, that's good. That's good. That's good. And Dr. Woods, I know that because of your efforts with the Black Church, that that more than 7,000 African Americans have gotten the shot in the arm because of the partnering with Black churches. Talk to me about the success of that, and why do you think that worked, and why do you think that resonated, and how do you feel that now 7,000 more African Americans now have the shot in the arm?
I feel great about that number, but I think we can exceed that number. We've been up against supply issues. A couple of things I'll say. First of all, African American churches and African American communities are always looked at as trusted, safe places of refuge. So having vaccines in those locations immediately removed barriers by making the vaccine available in their community at a location that they had access to, at a place that they trust. And I think that was a huge reason for the turnout. One of the other things, though, we've discovered is that the African American church doesn't just have trust within the African American community, it is trusted in other communities as well. So one of the things that we've seen that we were not looking for but noticed is a significant amount of the Asian population are coming to African American churches when we're having those vaccine sites in order to get their vaccine. And given what has been happening in the Asian community of late, what a great opportunity for expanding partnerships and building greater bridges of trust within the community with a group that feels, quite honestly right now, that they're under siege.
Wow. So what's next? You said that you want to increase that number. So what's going to happen to make that happen?
Well, access to more vaccine, using this particular model. Right now, more vaccine is now going to drugstores that are part of the distribution chain now. That was not the case earlier on. These mobile vaccine sites were primarily being ran either by the health department or by the hospital system. But as more vaccine is going out to drugstores and in some cases even grocery stores and other retail locations, it limits the amount that we have to be able to do these mobile sites within the African American community. With more vaccines, with Johnson & Johnson now being added, hopefully we will see more distribution and a greater supply, because with that greater supply, we could put more churches in the queue of being able to provide vaccines for that community.
Yeah, sounds good. Sounds good. We have another question from Tammy G, and this is for the doctor in the house. She writes, I am currently taking a Claritin once daily for my allergies. I have a COVID vaccine appointment coming up very soon. So she wants to know, is it okay to continue my allergy medicine, or should I stop taking it before my vaccine? What do you have to say to that, doctor?
Okay, so just so happens that I am an allergist, immunologist. So I'm a little bit familiar with the medication in question, but obviously I can't give specific advice, but I'll make this a bit general in that there is no contraindication that I'm aware of where you'd have to stop taking a chronic medication to get your vaccination. What I would say is that make sure you talk with your doctor, or nurse practitioner, or your healthcare provider. Make sure you talk with them to and ask those questions so you can make sure that you are comfortable with going to get your vaccine.
Gotcha.
That's what I would say.
Good, good. Thank you. We have a religious question for the pastor in the room. When I went out in the streets to ask people why they're reluctant, a lot of people said that they thought that that the vaccine was putting a chip inside them. And then you have some people who are religious and they think that we're the end of times, the mark of the beast, and and things like that, and they're trying to put two and two together, trying to line things up. So Pastor, I don't know if you had heard that that the vaccine is a chip, inserting a chip. So what would you have to say to those people who are who are religious and they think that way? How would you respond to that?
Well, the first thing that I would say is it's not the first time that religion was being used sort of as a straw person, if you will, as a reason not to do something. We've heard these kinds of conversations with polio vaccines, where people did not want to take it for religious reasons. We're hearing that now with an anti-vaccine movement of parents who don't want to have their newborns to have any vaccines. Here's what we know. We know that vaccines have saved lives. We know that vaccines have almost completely eliminated diseases like measles and smallpox and mumps and a host of other things. And in this global pandemic of COVID, we are fortunate and blessed to have another vaccine that can help address that issue. And we should be willing to receive and accept that, as we have with other ones, without placing some kind of a religious test or restriction upon it for not taking it, because it can be life-saving, not just for us, but as Dr. Walker-McGill reminded us, it can be life-saving for those that we love.
Yeah. Good stuff, good stuff. Astrid, tell us, what more can the county do in order to get the word out about removing those barriers? What more can the county do in relation to the Hispanic community? Because I guess you may have some county leaders who are listening right now, and I guess they have the resources. So tell us, if you had a one-on-one with a county commissioner and city leaders, what would you tell them that they need to do in order to remove the barriers and increase the trust within the Hispanic community, just in case if we ever have to have a health scare like this or other things that may happen in the future? What would you say?
Well, I think that they need to create more partnerships in the community, because especially with newcomers and immigrants, as we talked about, and many of our communities of color, there is not they do not come from environments where the government is trusted. This is a very unique quality of the United States culture, that we trust government in a way that almost that we trust, we have faith. And so it's very different from the countries that we come originally from. So we just need to make sure that our government partners with organizations, and entities like churches, like, Dr. Woods, and, with organizations that are community building organizations like the YMCA, or other organizations that are in language, in culture, supporting the newcomer community, because that's where you're able to really leverage the opportunities and the cultural competency that you already have in your community. So they're doing a great job right now. They have a new campaign that is going out, and I know Gina Diorio and the commissioners are definitely working very hard to engage everybody. But also, I think it's important to be able to provide choices to people. I would tell you that some people, when they came out with the Johnson & Johnson vaccine just recently, and there was a drive on the West Corridor, for instance, it was like only the Johnson & Johnson for the African American communities, and they felt like, why is it only that one? Why don't they give us all the vaccines? Why are we not having? And I think that is part of the bias that we have created in our communities, that you only get one thing because it is this community, right? So I think we just need to start building the trust in people that, yes, you have choices. Yes, this is the best that we are providing for you. Yes, it's Johnson & Johnson because it's one shot, so you don't have to take 2 days off. So just the communication is very important for in language, in culture, and in every way, to be able to keep the trust of our community and increase it, because right now it's critical. It's too much distrust, mistrust, misinformation that has been embedded out there, and it's not helping right now with this particular crisis.
Yeah, that's good. Dr. Woods, tell us, how can we, what can we expect from our community leaders? Because I guess advocacy, you're on that advocacy train, and I know we had talked about promises made or promises kept when it comes to affordable housing, education and things like that. So what do you think needs to be done to make sure that after this pandemic is over with, to make sure that people in challenging communities, that their needs will still be met, whether it be healthcare, education, and things like that? What do you think needs to be required from community leaders to make sure that the pressure and this still goes on?
That's such a loaded question. There is so much work. While we're in the midst of the conversation on the pandemic now, our school system had a policy decision CMS was going to vote on this past Tuesday night that would have lowered standards for teachers to receive 4-year contracts. Had there not been word that leaked out concerning that led to calls to school board members to pull that item, then that vote would have occurred and we would have never known anything about it. There is so much. There is so much going on with the 2040 plan that, if passed, and there's a rush toward passing that. If passed in its current form, it will significantly speed up displacement in minority communities. We just have to keep ringing the bell. We have to keep reminding persons that there are multiple issues out there that we're struggling with, and we just have to keep at it. Yeah. Power yields nothing but except to more power.
Yep. Yes. Well, thank you so much for spending some time with us. The conversation still continues, so we hope that something was said tonight to give you more knowledge and information about receiving the COVID-19 vaccine. And I guess just go to WBTV.com, because we are your vaccine station, and we can have all the information that you need in order to make that decision. So thank you so much, Dr. Ricky Woods, Astrid Chirinos, and Dr. Cheryl, for spending some time on your Thursday night. So thank you, and thank you for joining us at home. Until the next time, until the next community conversation, stay safe, and we'll see you soon. Thank you.
Thanks.
Thank